Good afternoon.
No, I will start. I will start.
Okay.
Let them give a signal.
Okay.
All right, hi guys. अभी मैं आपको जिससे मिलाने वाला हूँ, he is an absolute genius and the guy who has actually stood and overcome all the challenges to get through this examination. I want to introduce to all of you guys Dr. Shazib from Kerala. Dr. Shazib is one of the student who was actually lagging behind with few marks in the previous attempts, and I want him to share his story. Dr. Shazib, first and foremost, many congratulations on this wonderful victory of yours.
Thank you, sir. Thank you, sir. Thank you.
Shazib, tell me about yourself and about your journey in short.
My name is Shajeeb Rasheed.
Right.
I'm from Kerala, and I studied from Northern State Medical University,
Okay.
Russia.
Okay.
And this was my fourth attempt,
Okay.
which I passed with 177 marks.
Very nice. Great.
Uh, then I actually I was so I like I don't know what to say. I am so happy right now for
Yes, yes.
to
Let
write
me
this.
help you out. Let me help you out. Let me help you out.
Okay.
Basically, when a student pass, everything feels very dreamy, very good. But I
Yeah.
want you to focus for your friends who somehow could not get through this because you
Mhm.
have already, tasted this bitter, result in the past. How did
Yeah.
you handle that
Mhm.
bitterness in the past?
Actually, which my parents helped me a lot.
Okay.
My parents was my backbone actually in that phase.
Hmm.
Then they supported me like whole entire my career. So
Bilkul, bilkul.
it was and I don't know how I overcome, but because of their
Your
support,
parents were
I
the
just overcome.
backbone, your parents were the support pillars. That is,
Yeah,
that is very, I can say कि काबिले
yeah.
तारीफ फिर से मैं बोलूंगा है ना. Now, tell me, how did you come across, PW platform?
Actually, I was in offline mode in last attempts and this attempt too.
Okay.
And I was following Sudha ma'am ophthalmology, and
Okay.
she for the last attempt when I failed for with 142 marks, and
Okay.
she in that story in Instagram story.
Okay.
It was there was one offer. There is one scholarship for MedEd for
Oh,
135 plus
yes, yes,
marks.
yes.
So I just I don't know whether I will get that scholarship or not. I just
Did that.
uploaded my name and I uploaded my scorecard and all. And
Okay.
after 2 or 3 days, when I just opened that Medad app, it
Okay.
was all videos and tests were opened, and I was
Okay.
so happy there at that time. I was like, whether I should take. I was in that mode, like whether I should take some other online platform or something.
Hmm.
And this method, which helped me a lot because
Okay.
many teachers were, which uh, I was studied like
I've been following this long. Yes, you have been following all
yeah,
the. Hmm.
following teachers like
Hmm.
Upta, surgery, Sandeep sir, Dharma sir,
Hmm.
Jasir,
Hmm.
like that, and it helped me a lot.
Which
Like
feature do you
when I
think, which part of the app do you think you utilize the most and that helped you a lot?
like I told you, I was in offline mode,
Okay.
and whenever I miss any classes or
Okay.
all the I didn't went for class in offline mode.
Okay.
I studied from online. Like
Okay.
I didn't because in my that was my confidence. Like I have every videos and every classes of Sudha ma'am.
Hmm.
So and Sandeep sir also. I don't know. Like every whenever I have doubt, should I, whenever I want to, in offline mode, we can't take back that, in like online mode, we can't go back and come around, right? So
Right. Hmm.
I, for reference and all, I study from that.
Yes.
And the rapid revisions, it helped me a lot in that
Rapid.
end moment.
Okay.
Yeah.
Okay.
Uh, then
Did you
about
attend the
few
GT
bank.
grand test on the grand
Yeah,
test?
yeah, but the questions were so difficult in that, for me. Like, I don't know whether I have to say, but
Yes, yes.
most of the questions were. That's why I think I got this mark. Like, I
Good.
was like, this is not my. I was trying hard to get good mark in this level. Like, it's
Hmm.
so difficult. So uh, I was trying hard for getting good mark in. If I was like, if I get this good mark in this, I will get
Bilkul, bilkul.
I will pass
When
in that
you're trained
main
already
exam.
at a higher level, getting a
Yeah,
little lesser will be
yeah,
much easier rather than just
yeah.
yes.
It helped me a lot.
Exactly.
That difficulty level helped me a lot, because
Excellent.
my mind was like training to overcome. Like, I want to pass this. Like, in this method, if I pass the exam,
Hmm.
I will definitely I will pass this. My mind was like that.
I totally understand. I totally understand. And the minute when you said, "Ki, sir, this was my fourth attempt," and I
Yeah.
was into awe that usually a student after one attempt or two attempt, student like to leave things and they like to leave it everything. I don't want to take it further because again, this
Uh-huh.
examination does not just test your medical knowledge; it also tests your
Uh-huh.
intelligence,
Yeah.
your emotional
Uh-huh.
quotient,
Yeah.
your IQ being tested, that is okay, but your EQ is also being tested at the same time, and also how patient you are. Because this is going to be a fight of an identity. You know? I always say
Uh-huh. Yeah.
class as well because just prior to the examination, you were a 12th pass student because India is
Yep.
not considering your degree and your Russia is not
Yeah.
allowing you to practice. So just prior to the examination, you are a 12th pass. After the examination, suddenly you get the tag that no, you're not just Shazib, now you're Dr. Shazib.
Yeah.
Earlier, you were not allowed to write even paracetamol, but now you are allowed to even do
Yes. Yes. Yes.
paracetamol.
Yes. Yes.
And if you are skilled enough to do even the minor procedures and to prescribe
Uh-huh.
to the patients, now you have the license to everything. And now everything is
Yes. That
everything.
satisfaction is very.
Bilkul, bilkul. So that is why I say that this examination it tests a lot of things. So right now, after getting this score, how is the reaction of the parents?
Oh, they were so happy. Of course, they were so happy. Like, four attempts, they were. I
Right.
don't know how much they struggled. Uh, they were so happy. Like, I
I
never
always
see them this much happy in my entire life.
bilkul, bilkul. I totally agree with this. I always say that when a student gives examination, it's not only him giving exam, along with him, even the
No,
family
no.
also giving.
Yeah,
Family is
of
going
course.
through
They are
everything. They're
also,
going through sad phase. They're
of
going
course,
through
of
sad
course,
phase.
of course. The family, they are also with me. Like, I can't take every like compliment in this exam,
Definitely,
because
the entire credit. I mean, okay, I'm giving you the option.
yeah, I can't.
Who all are the person you would like to give the credit to your success? Please go ahead. Take this opportunity.
uh, for me, first, my mother and father
Bilkul.
and my brother. He also, like, whenever I get too
Hmm.
low with my emotions, I used to call him, and no, he used to call me whenever get my emotions get very bad.
Hmm.
And he used to tell me, "Don't worry,
Hmm.
we are also trying. We are also supporting you. Like, don't worry about anything. You just focus on your studies."
Hmm.
Even my mother and father used to tell me, "Don't
Hmm.
focus on anything. Whatever happens, don't worry about that. You
Hmm.
just focus on study." you just focus on study. These four attempts, four attempt, it took 2 years. So
Hmm.
these 2 years, they were like, I never heard anything like why you. Whenever I failed, like three attempts, whenever I failed, I never heard from them like why you are not studying or why you are not doing this or why you are. I never said why that question mark. I never said.
Hmm.
They were just saying, go ahead, study.
Hmm.
Where do you wanna go? You wanna go to Delhi or some other place? I choose your career, like choose your path.
Hmm.
Just focus on that.
Hmm.
That helped me a lot.
Hmm.
So I think 70 to 80 percentage of my this passing percentage was by them, like
The reason,
because
the
of their.
reason why we say always that family is important. That's why family is
Yeah,
important. And remember this
family is
not
very
only
important.
now, remember this not only now, even after 10 year,
Yeah,
20, 30 year down the
of
line,
course, I
you'll
will.
always remember
I,
this. Family is
of
important.
course,
And
of course, I will never forget that.
very nice. I'm really very happy. I'm very glad कि, how supportive family you got. And कई बार, many times that has happened also that students are coming to us with, eyes full of tears कि, sir, my family is not supporting. Family is saying कि, okay, you join some other business,
Yeah,
join the family business, or we are getting you married, you're not able to do in one attempt, two attempt. But
mm,
here the story, wherever I have seen, the family has been supportive. The family understand the pain. See, any student, those who are getting 120, 125, 130, any student who is getting this kind of score now, so I always say that they have been studying. It's just that they have not
yeah,
focused enough, possibly
yeah,
from the medical college, right? Suddenly they are trying
yeah,
to a couple of attempt takes and they get through this one. And that is why one more recommendation that I always give currently, you see, the education is so accessible. If you look 5, 6 years down the line, there were no online,
yeah.
there were no offline,
Online platform.
any
Ev-
education program was not there for
yeah, yeah,
FMG. Come to India, you join some classes and then you give examination. And most of the students used to take 3, 4 attempts. Earlier, the passing percentage was only 4%, 5%. But now the education has been so accessible that even a student who is studying in far away from, India, far away from their home country, they can access, these educational
yeah,
platforms, their country,
yeah,
and
yeah,
many students are using it also. So,
yeah.
can you tell me if you have to give one advice to your juniors, what advice will you give about the mistakes not to make? And second one, when should they prepare? Let's say your juniors are in first year, second year, third year, they all are listening to you. What advice would you
Yeah.
like to give? Mistakes to avoid, that is number one. And second, when
Okay.
should they start preparing?
Mistakes which I have done was
Yes, yes, yes.
I
According to
didn't
your experience.
I did yeah I didn't study it from university. Like I was following their curriculum. I
Okay.
didn't uh, I didn't study it like I didn't start preparing. I was concerned about preparing, but I didn't try to give some effort for that. If
Hmm.
I could have start from second year or third year
Hmm.
onwards, I
Hmm.
could have achieved this mark before two attempts.
Okay.
I could have got that. And I think the proper I think proper start uh, from third year or second year
We should
onwards.
start, right? So
Study,
basically, what you
I
said,
just
should they start studying from the medical college? And ideal time to
yeah,
begin will be usually third year. That's what you said, and that's what we
third,
always. That is
yeah,
absolutely right. Because I always say, when you have walked through this path, you already
yeah,
know what all things are happening. And now you are in a position to mentor. Now you are in a position to guide and give advice to your juniors, and
mm-hmm,
listening to you also.
mm-hmm,
They'll be listening to you with
okay,
lot of keen interest that okay, this is what
mm-hmm,
I follow and this is what Shazib bhai has done to get through this examination. है ना?
mm-hmm, yeah. Uh, Actually, I have one more advice to those
Yes.
who have completed their university, and they are right
Hmm.
now they are having took any coaching center or any coaching platform. They are studying right now for the
Hmm.
December attempt.
Hmm.
Uh, I just want to tell them that don't focus on the mark which we get from the which when we do the Q bank
Okay.
or GT. Uh, just focus on the study. Focus on the reviews. Focus on the main notes, and just start doing Q banks. Start even I had many friends who study a lot.
Okay.
They just study. They just watch videos. They just study, but they don't apply the knowledge to questions.
Okay. 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 Very nice. So I think what message I am taking from here, that you study, that is good, but try to apply the knowledge also on MCQs.
Knowledge on the
MCQs.
MCQs. Yeah,
Yeah,
and
definitely.
whenever we do any GPs or any Q banks, uh, like whenever get I used to get a low mark. I don't used to get whenever I do. I just get 48 percentage. Even if I do 20 questions, I will get 48 percentage.
Okay.
Like like that.
Okay.
So in that phase, many friends told me that I'm not getting well marks, so I will study everything and I will do the Cuba.
Mm-hmm.
Uh, for from my point of view, I don't do that, and do MCQ every day.
Okay.
Do try to uh, apply the knowledge. I
Yes.
think most of the question came in the last attempt. It was like everything was applied knowledge.
Applied knowledge, most
Uh,
questions were clinicals, earlier
yeah.
they used to ask that what is the
So
antidote of opioid poisoning, but now they are saying a
okay,
patient is presenting with this symptom and he was
symptoms.
diagnosed with
Yeah.
this. Now, what is the antidote? So everything is going to be clinical.
Yeah.
And
Yeah.
what I believe is clinical questions are not very difficult. If you have the knowledge,
Yeah.
always tend to give you a lot of information,
Yeah.
so that
I
you can actually
we, there is no there are many questions, but most of the questions were this clinical type questions. We want to apply our knowledge for applying knowledge. We want practice. If we want to practice, we want to do that Q bank or questions, and we want to apply that. Most of them they are afraid of failing.
Hmm.
For me, whenever my friends used to tell me, I'm so afraid that yeah, I can't do this. If I get low mark, I will get so desperate, so I can't. I will be going to depression if I get this mark.
Hmm.
I just overcome that. Like whenever I do, I
Hmm.
don't care about the mark. I will just do the questions. I will review that. That's it.
That's it. That's it. Very nice. Very nice. So your final message to your students, I hope your students, I mean, your juniors and other junior student, other, student, those who are trying, कि भाई साहब पढ़ाई शुरू कर दो as soon as possible. Second year, third year is the
Yep.
ideal time, and the
Yeah.
basic knowledge, if you have, you'll be able to ace through this one. And along with studies, try to do MCQs. Don't be
Yes.
disheartened if the score is less. That is what you said, Shazib.
Yeah.
The score is
Yes.
less.
Yes.
Don't
Yes.
be disheartened. Just try to practice, keep practicing, and your day definitely will come. And one day you'll be sitting giving interview just like Shazib,
Yeah.
right?
Yeah.
Very nice. I'm very
Yeah.
proud of you, Shazib. Many congratulations once again to you
Okay.
and to your
Thank
parents.
you, sir.
And I'm really
Thank you.
happy that
Thank
how your parents supported you throughout the journey.
you.
Please
Yeah.
pass on my
Yeah.
regards to your parents, to your brother, everyone around.
Okay.